Hi, David Thomas here, chiropractor based in South Wales. We've seen a lot of frozen shoulder type injuries at the moment in clinic, so I thought I'd do a video about some exercises on how to help with shoulder injuries, what is frozen shoulder, and what happens when you get it. So what is frozen shoulder? Frozen shoulder is a soft tissue capsular lesion which leads to painful, active and passive and restricted range of motion in the glenohumeral joint, which basically means that you've got inflammation in this area which affects your movement when you try to move your arm or when someone else moves it, and you get pain in this area by here. So who gets frozen shoulder? So typically in the general population, 2 to 5% of people will experience frozen shoulder at some point. 10 to 12% of those people will have it affect them bilaterally, so both arms. Usually one will happen first, and then maybe you'll get the other arm within a couple of years' time. If you have diabetes, you're more likely to have frozen shoulder, so the incidence rate is 10 to 20% of that. And it does seem to have a more preference towards females, with a 60 to 40% split, and it seems to happen between the ages of 40 to 60. So there's three main phases of frozen shoulder. You have freezing, frozen and thawing. Frozen shoulder in itself can last between all those three stages up to 30 months. It can take a long time to get better. I'm going to discuss each of those stages now differently, okay? So freezing is the first stage. Like I said, it can usually last 2 to 8 months. It's people often present with a dull, achy pain, very painful in this sort of area. People often sort of notice that lying on that side is quite painful at night. Brushing your hair or trying to get your hand on your head is very difficult. If you were to put your coat on and put your right arm in first and the left arm was the affected arm, you'd find it very painful, very difficult to get the arm into the sleeve. Patients, especially female patients, will sort of say things like they find it very difficult to do their bra up, so this motion behind your back is quite difficult also. So the next stage is the frozen stage. This usually can last anywhere between 4 and 12 months with no treatment at all. This is where usually I think you see most people present because the pain has subsided slightly, but they're still finding these movements, like we said, putting your hand to your head, hand behind your back, quite difficult. You tend to find in this stage, because of the pain in the freezing stage, people tend to use their shoulder a lot less and try and protect it, so it actually increases the rate of the stiffness. So there, people then will come in, and this is where we'll see people can only bring their hand up to here, or come out to the front and only come into this without getting, like with this hand, as high up as they can. And finally we have the thaw-in phase. The thaw-in phase lasts 4 to 12 months or so without treatment. During this time now, the range of motion starts to come back spontaneously. People find that they can do a little bit more, and as that sort of inflammation subsides, the shoulder starts to get back to where, in terms of range of motion, where it was before. So this is George's skeleton. What do I mean when I say intracapsular lesion? So this is that soft tissue lesion, and this is here into the shoulder joint. And we have a couple of muscles, and because the shoulder is a ball and socket joint like this, we have a lot of movement, but obviously one of the limitations to that is it's not as strong as maybe an elbow joint or a knee joint. So to have that sort of strength, we have muscles and tendons which come in. So we have one which comes under here, sort of comes, if I can show you, just sort of under that collarbone, comes under here and attaches onto the shoulder. That's called your supraspinatus. Okay, so we've also got three muscles which are on the back of the shoulder blade here, which sort of sit like this. So you've got your infraspinatus, you've got your teres minor and teres major. We also have the supraspinatus, which comes through here, comes through this groove like this, and then sits onto the top of the shoulder by there. Please feel free to like and subscribe for more videos as they come. Thanks everyone, bye now.